Hello guys, welcome back to Pharma Palette. So today in this video, we will be discussing about the anemia and its types in detail along with the notes. And the points which I say here are exactly what you can write in your exams to score well. So without any further delay, let's get into the video. What is anemia? So this is defined as the condition where there is decreased number of RBC. Either decreased number of RBC or the hemoglobin amount will be reduced in the blood, which is called as anemia. Anemia. So in the anemia, first we have to see its definition. So anemia is a condition where there will be decreased RBC cells. So we can define it as a condition where there is decreased number of RBC or the amount of hemoglobin in the body is reduced. So that condition we will be calling it as anemia. So this is mainly divided into three types. So one is microcytic, normocytic and macrocytic. So in the microcytic type, here the RBC cells will be not having enough amount of hemoglobin, due to which the size of the RBC will be smaller than the normal size of RBC. Coming to the normocytic anemia, here no enough number of red cells will be produced to meet the body requirement. So due to which it will be leading to further chronic diseases. So when sufficient amount of red blood cells are not produced from the body, it will be leading to chronic diseases. So now coming to the third type, which is macrocytic. So in the macrocytic type, simply this will be happening when our bone marrow will be making the RBC a bit larger size. So when the bone marrow makes the RBC larger than the normal size, so that condition we will be calling it as a macrocytic anemia. So that is all about the definition and the main types of anemia. So these are the different types which will be classified under all the three different types of anemias. So in the microcytic anemia, there will be iron deficiency, sideroblastic and thalassemia. And in the normocytic, there will be hemolytic anemia, aplastic anemia, blood loss, anemia of chronic diseases and the bone marrow infiltrative disorder will be there. And in the macrocytic anemia, there will be megaloblastic, non-megaloblastic and the vitamin B12 deficiency anemia. Now let's discuss each type of anemia in detail. So the iron deficiency anemia. So this is the most common cause for this microcytic anemia. So here the body will be not having the sufficient amount of iron to make this hemoglobin. So without this hemoglobin, the RBC will be taking longer time to transport the oxygen throughout the body. So when it is taking longer time to transport the oxygen throughout the body, the person will be having the symptoms like tiredness and also they become out of breath. So that is happening in this iron deficiency anemia. So what all points you will be including in this? The first point is this is one of the most common cause for this microcytic anemia. Second point is here the body will be not having the sufficient amount of iron to make the hemoglobin. Third point is when the hemoglobin is not there, so without hemoglobin the RBC will be taking longer time to transport the oxygen throughout the body. Then the fourth point is when it is taking longer time to transport oxygen, the person will be feeling tired and out of breath. So keep this heading, write these 4 points, then we will be writing common causes. So coming back to the common causes. So here this can occur because of blood loss. This deficiency can occur because of blood loss. It can be occur if there is no iron in the diet. When there is no sufficient iron in the diet, this can occur. This can occur if a person is having difficulty in the iron absorption. And also in case of pregnancy and childbirth, this can occur. Second type, which is the sideroblastic anemia. So this will be also coming under this microcytic anemia. So in this anemia, Here, the bone marrow in the body will be not able to make the healthy RBCs. So that means it will be either making small RBCs or large RBCs. It can be micro or macro RBCs will be made. And this can be occurring because of different causes. This can occur, maybe the person will be born with this condition, or this will be developed due to the use of certain medications. So these are the two important causes. Now, what all points you will be including in the sideroblastic anemia? First thing is, in this condition, the bone marrow will be not making the healthy RBCs, due to which there will be production of the RBCs which can be smaller in size or they can be larger in size, which can be called as micro and macro RBCs. And the main causes for this is the person may be born with this, or it can be developed due to certain medications. So the third type is thalassemia. This will be also coming under this microcytic anemia. So this is actually a blood disorder. So in this condition, this can mainly occur due to the inherited genes. So what happens in this? The body will be making the hemoglobin, that too in the abnormal form. So the body makes hemoglobin in the abnormal form. So this will be available in different types. So different types are there in this, and each type will be affecting the RBC differently. And if we consider the treatment for all the three types, you can treat it with, if it is iron deficiency anemia, you can treat it by taking the iron supplements, or you can treat it by taking the iron rich foods, and also by taking the vitamin C supplements. And to treat this sideroblastic anemia, we can use the vitamin B6 therapy. So vitamin B6 is simply the pyridoxine. And to treat this thalassemia condition, bone marrow transplantation can be done. So, in the normocytic anemia, the first type is anemia of chronic disease. So, here this will be mainly causing the inflammation. So, this disease will be causing inflammation, due to which this can decrease the RBC production, or it can cause the production of weak RBC, or it will be making the RBC which will be dying very quickly. So, in this condition, mainly this will be leading to inflammation. So, whenever there is inflammation, it will be leading to this ACD condition, which is anemia of chronic disease. So, this is generally seen in different types of disorders. It can be autoimmune disorders like rheumatoid arthritis, lupus, or it can be seen in the conditions like TB, HIV, cancer, etc. So the next condition was blood loss. So this will be causing either because of injury, or it can cause because of heavy periods, or this can also be caused because of GI bleeding. Coming to the hemolytic type, heme means it is RBC, lytic means it is breaking down. The name itself says it is a process of breaking RBC. So here the RBC breakdown will be there, that will be occurring very rapidly and fastly, which will be causing to different conditions like sickle cell anemia, or it can also can lead to the cause of G6PD deficiency. Now coming to the next type, which is aplastic anemia. So in this aplastic type of anemia, this will be occurring whenever the stem cells in our body which are present in the bone marrow, if they are not able to make the enough RBC. So, aplastic anemia occurs when the stem cells in our body which are present in the bone marrow, if they are not able to make the sufficient amount of RBC, that will be leading to the condition of aplastic anemia. This aplastic anemia, it is a result of body's immune system which is attacking the bone marrow stem cells. So there is one more type in this, which is bone marrow infiltrative disorder. So normally we know that the RBC is having a lifespan of 120 days. Once the RBC gets died, the new RBC will be formed. So in this condition, the RBC will be produced, but it will be larger in size because this will be affecting the bone marrow part, which can lead to different conditions like leukemia. So coming back to the megaloblastic anemia, so here the main cause is the impaired DNA synthesis. Coming to the common deficiencies, this can occur due to the deficiency of vitamin B12 or folate. The bone marrow will be looking hypercellular and certain megaloblastic changes will be seen. Coming to its symptoms, the person will be feeling fatigue, pallor if they are having vitamin B12 deficiency, and certain neurological symptoms are seen. Coming to the non-megaloblastic anemia, so here the main cause is not due to the DNA synthesis. And coming to the common causes, this can occur due to the alcoholism, this can occur due to the liver diseases, it can occur due to the hypothyroidism, or some other drugs will be responsible for this. And in this condition, this will be mainly altering the lipid metabolism. So this will be altering the lipid composition of the RBC membrane. That means this will be increasing the reticulocytes. And here there are no neurological symptoms observed. Coming to the vitamin B12 deficiency, this is simply, it is a form of megaloblastic anemia. And here the main cause of this is, main causes can be pernicious anemia or it can be malabsorption by giving the vitamin B12 supplement. So that is all about the anemia, its different types in detail. I hope this video has helped you. If you found this video helpful, don't forget to like, share and subscribe to Pharma Palette. See you all in the next video and thanks for watching.